When Kathy Martin turned 50, she hit the gym.
And I want to be active for as many years as possible.
What worries you the most about healthcare costs?
Not being able to access care. When you have to prioritize your living expense versus healthcare, that's a major problem.
Martin is in good company in this Silver Sneakers fitness class, whose members are working on staying healthy, but worry about the future.
What's going to happen when I get older? You know, how am I going to be able to pay for the care that I need?
Premiums for Medicare Part B medical insurance for those 65 and older increased nearly 15% this year, almost double the pace of inflation. According to one estimate, if health care costs remain this high over the next 2 years, a healthy 55-year-old couple retiring at 65 is facing an additional $267,000 in medical expenses. Total health care costs for this same couple could exceed $1 million. That's nearly as much money as they could expect to receive in Social Security benefits during their lifetime.
Whether you're affluent or whether you're the average person, I'll tell you what, when you look at your Social Security check, you're paying for health care.
Regular exercise may keep you healthy, but overall, health care costs keep going up. If you're worried about rising medical expenses, financial experts say the first thing you should do is understand what your health insurance will and won't cover.
You really need to look at the coverage in those types of plans to determine what makes the most sense for you.
Instructor Melanie Scala has been teaching this class for over a decade.
I'm here to help them to not have medical costs. I'm here to help them to exercise and feel better.
Yet staying healthy also requires planning ahead to be able to afford health care costs in the future.
And Sharon joins me live now. Sharon, Medicare premiums rising nearly twice as fast as inflation. That is nuts. How about outside of Medicare? Should non-retirees be concerned here too?
Well, they're already concerned. You know, CNBC did a survey last month, a personal finance survey, and behind jobs and the economy, the biggest issue people were concerned about, health care. And the issue is that right now we are looking at U.S. employers expecting that their group insurance coverage, health insurance coverage, will increase about 5% this year. And so that's nothing compared to the 8.5% we saw in the rise in the consumer price index last time for that reading. But it's still significant as we're concerned about what's going to happen as people go back for preventative care, for elective surgeries that they put off during the pandemic, as well as the rising wages that should be paid to nurses and staff at hospitals and other providers. So there are certainly going to be impacts on the cost for health care for everyone going forward.
So, Sharon, what are some smart ways people can save, can help defray their medical expenses? I mean, there's just only so much money to go around, right? Given what inflation is right now. I mean, people are running out of the ability to save money.
They're running out of the ability to save money, but maybe we can be more strategic about where we put the money. So for those who are worried about health care expenses in retirement, making sure that you're putting in as much money as you can into your retirement accounts is really critical. And many people who are 50 and older don't realize that they can put in an additional catch-up contribution to their 401k to bring it to $27,000 that you can put away for the max in a 401k if you're 50 or older, or an extra $1,000 that you could put into an IRA, bringing that up from $6,000 to $7,000 for this year. The other thing to think about for health care costs right now and in the future is if you have access to a high deductible health care plan and you have a health savings account that you can contribute to as well, maybe that's where you put some of the money that you'd like to make sure goes to health care. Put it in that account. And again, if you don't use it for health care right away, it can continue to grow. You can invest that money and then you can use it for retirement as well.
Sharon, you know, we've been talking so much about the Great Resignation. If some of our viewers are watching and thinking about retiring, quitting their job, leaving their company, what are their health insurance options once you walk away?
You know, well, today it's very difficult to get retiree health care benefits. Only about 4% of companies, of major companies, offer that right now, according to the Employee Benefits Research Institute. So it's really important to do this on your own. And the other thing that you can do, I learned this from my mother, is to Make sure you exercise. I went to that class of seniors because it's just like the class my mom goes to in Pittsburgh, where everybody is really just trying to stay healthy as a senior, trying to stay in shape. And it's so important. So, yes, that means you're probably going to live longer. You know, you see I need to practice more, Allison. You see I can barely keep up with her.
No,
but
I'm so
doing
impressed.
my best. I'm doing my best.
Well, way to go, Mom. I absolutely love it. You know I love my Pittsburgh Eppersons. That's fantastic and good reminder. Stay healthy, exercise, and try to save what you can, even though it's getting tough these days.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.